Hello cyber friends near and far. I'm about to ask you a very important personal favor. Please pass on this video. You never know who you may help or even save. 1 in 4 people in your life will die of heart disease. 1 in 3 women will die of heart disease. I'm a heart attack and cardiac arrest survivor. I actually died on June 4th, 2014. I'm 48, married, and I have 2 young children. The day before my heart attack, I actually stayed home from work because I was feeling extremely tired and a little bit achy. I have the usual symptoms that people have when they think they're having a heart attack. In fact, I got up that morning and worked out and even did some upper body weight training. This particular morning, the day of my heart attack, my husband decided to swing back home after dropping my daughter off at school so that he could take my son to school. Thank God he decided to come home. My husband returned to our house. He came upstairs and found me in bed. I was cold, blue, and unconscious. He started to yell my name and slapped my face. He pulled my eyelids and saw that my eyes were rolled back up into my head. My husband yelled and asked my son to grab the phone so that he could call 911, and my husband began CPR on me. My son ran downstairs to open the door and greet the medics and help them find their way to me. Medic used a defibrillator on me. My heart was not beating. I was in V-fibrillation, ventricular fibrillation. He did use the AED device one time, and that did return my heart to beating again. However, I did not regain consciousness. Taken by ambulance to Tri-City Hospital, and they performed a surgery on me which determined that my LAD artery was occluded or blocked 100%. This heart attack is called the Widowmaker heart attack due to its low survival rate. They performed a surgery and put a stent into my LAD artery to reopen the blood flow. I was kept in the intensive care unit, and they actually lowered my body temperature. This is to help prevent further damage to the brain or even to other organs. And the lowered body temperature is sustained for 48 hours. And you are also medicated through this to remain in medically induced coma. When I woke up on Friday, my husband was at my side. I looked at him and said, "What happened?" And he explained I had had a massive heart attack. They quickly checked to make sure I could wiggle my toes and fingers, and we're very happy to note that everything was physically working as it should. My heart had gone into ventricular fibrillation due to a blood clot that had entered my LAD artery. V-fib, as it's called in short, is the most serious cardiac rhythm disturbance that there is, according to the American Heart Association. The lower chamber of the heart quivers, and the heart does not pump, and it doesn't provide blood or oxygen to the brain, and the victim loses consciousness immediately. Why is this important to you? Because the statistics are staggering. For 42 million women living with heart disease in America, 54% of women and 50% of men who die from coronary heart disease from sudden death had no prior symptoms. A woman dies every minute in the United States of heart disease. For women may include chest discomfort, pain, squeezing, burning, and pressure, which can be mild or severe. These symptoms may be constant or they may come and go. Women may feel discomfort in both of their arms, their back, their neck, their jaw, or even in their stomach. They might feel shortness of breath. They might be dizzy, nauseated, and they might break out in a cold sweat. They may feel anxious, tired, or even extremely weak. This can happen with or without exertion. So much for your time, and God bless you and yours.